Hey everyone, welcome to the Business Minded Sports Physio podcast, where we dive into a multifaceted world of sports physical therapy and explore how professionals navigate their careers and business ventures. I'm your host, Brian Schwabe, and today we have a very special guest, Ann Degrey, an experienced emergency medical responder and sports physical therapist who also serves as an adjunct professor. Ann, welcome to the show.
Hi, thanks for having me. Excited to be here.
Definitely, this is great. It's nice to be able to catch up again a little bit. I know we chat from time to time, but it's nice to actually be able to sit down and have a conversation on some things. So today, I really wanted to talk to you about your emergency medical responder career, basically, because you are one of the sports physical therapists that have really pioneered working as an emergency medical responder. And I know you have a course, and we're going to get to that in a little bit. But I want to start to talk to you a little bit first about your role as an emergency medical responder in the context of sports physical therapy. How did you get into this field, and what does the work typically involve?
So I started at a really big sports clinic out in Pasadena, and I was really fortunate that that facility also shared a kind of like a personal training grounds for the LA Galaxy back when they trained in Pasadena. And so I was introduced to a lot of the coaches, a lot of the trainers there, and at the time, there was a need for athletic trainers and also a need for a trainer to be present at not only the professional games, but also at like the youth level. And so during the daytime, when the Galaxy would come and train, afterwards, there would be these youth soccer clubs that would come in and train as well. And they're always looking for some sort of a trainer and they can't find one. So that's initially how I got introduced to it because I said, well, I'm a physical therapist. I don't exactly know what to do like a trainer does, but I can put on band-aids and if someone gets hurt, I know when to call 911 and I'm CPR certified. So if you're okay with that, I'll come out and help, right? So I started with that and they started inviting me back, every weekend. I would work every weekend and gain a little bit more experience, be exposed to a little bit more stuff. And then those people kind of led me to other coaches and other teams that need help. And that kind of helped me figure out how I wanted to be a sports therapist. Because at the time I was a new grad, didn't know what I was going to do, interested in sports and ortho, but wasn't really sure like what that meant at the time. But I know I really enjoyed being out on the field and helping these athletes, outside of the clinic. So from there, I just met the right people, volunteered a lot, and then took a bunch of courses, started getting my foot in the door with more professional venues. And at one point, I wanted to be an athletic trainer. Like I was going to go back to school and get my ATC just because physical therapists were not known to work sidelines at all. Um, when they get brought to the sidelines, you're working in a tent, in the back. You're not really sidelines. So I was like, you know what? I think I need to be an athletic trainer in order to do this. I even looked into it and they said, you know what? You need to go back to college and take all the prerequisites to go to athletic training school again. And I was like, no way. I'm not going back to get a bachelor's just to go and get my ATC. So looked into it a little bit more, and that's when I learned that, our SCS board certification does have some emergency training sidelines, and then pursued that to get further into my, sports career. And so that's when I realized, you know what? I want to be a sports therapist. I want to treat athletes inside the clinic, but I also want to treat them outside the clinic and really pushed myself to take, all the classes I need to be prepared to work sidelines. And then, that led me into teaching as well. So kind of like how it started.
That's awesome. Yeah, I was exposed to sideline coverage just in residency, right? I did a little bit in college just to, like you said, band-aids and, just basic things, right? Just to get exposure and immerse yourself in that world with different trainers and whatnot. And you learn a lot from trainers and you learn a lot from being on the sideline. I'm curious, what do you feel like are, based on your experience, some of the unique challenges you faced as an emergency medical responder in some of those sports settings?
Well, first of all, just knowing what to do, right? And to do it quickly. Athletic
Hmm.
trainers, they have 2, 3 years of training. That's what they went to school for. Us as a physical therapist, we have no training in this. And then when it comes to an emergency, it's like making those split-second decisions and doing it well and doing it with enough education in your background so that you don't get in trouble for it as well, right? So I find like that really challenging. And then also, our scope of practice, understanding our scope of practice as a physical therapist and how we can incorporate emergency management into it without overstepping your ATCs who are also present, or your medical doctors, or your sports medicine doctors who are present. And so, kind of working together collaboratively as a team, instead of saying, you know what, I'm the EMR, like I can do so and so and so, but more so like, how can I help out? How can I be useful? How can I enhance this team? Um, I thought initially that was the most challenging, figuring out where I fit in and where I can be like the most useful to everyone.
Yeah, you bring up a really interesting point about scope of practice, and every state's a little bit different, right? And I'm sure you're aware of this as well, since you teach a course that's very comprehensive on this. But can you speak a little bit, maybe just on California and what you've noticed? Because to me, it's always been a little bit gray of the scope of a physical therapist who is a board certification or just even emergency medical responder. Tell me a little bit about what you've learned and what's not super clear still,
Well, honestly, it's all not super clear still.
right?
But if you were if you were to work in a setting where you had a team, right? You have your doctor, your
Hmm.
chiropractors, your ATC. I step in as a physical therapist. Then emergency management always goes to the athletic trainer and the medical doctor first. So they kind
Hmm.
of like are the leaders of that. And I'm there to be as super useful as I can. And I have the knowledge that if they need help or if they're not available, I can step in and take over and help them out. In a setting where I'm the only person available, then you kind of have to decide which which license you're going to use. Most of the time, Sidelines, I'm using my EMR certification, right? So I'm treating the athletes for emergency situations, and I'm not necessarily doing full evaluations and assessments and physical therapy treatments on the sidelines. I'm just there to deal with anything that might arise, and I need to take care of it really quick so they can go back to the game. So then I would use my EMR certification. But it is great in that, like, if something were to happen liability wise, they take your highest degree. So they take your physical therapy degree first, right? And then they
Hmm.
say, how come you're doing this emergency management on this athlete when you're not an EMT, a athletic trainer, or a doctor? So then, you say, I have this background, this training, this sports certification, I'm an instructor, all this stuff, and you try to say that I'm doing the best that I can within my scope still, without overstepping boundaries and making the best clinical decision that I can to help this athlete out. Trying to justify yourself as much as possible. Um, but again, they're going to see you as a physical therapist first, and EMR second. When I work outside of California, because I hold a California physical therapy license, I technically cannot provide physical therapy treatment outside of California. So, like when I'm traveling with a team, technically can't provide that kind of service, but I can provide emergency medical service. And I have to kind of strictly stick to that. So, according to CPTA, because I double checked with them, I can work outside of California as an EMR, but I cannot work outside of California as a physical therapist. So the gray area is all around you. And I just tell my students, you have to just make really good clinical decisions and just know liability wise, if someone were to come at you, you know how to justify yourself and you have all the training in the background to like stand your ground.
Good advice, and something that I think a lot of people that want to get into emergency medical responder to work sidelines or game coverage need to know. And one of the things that pops up when you're talking about this is a lot of these games that you will cover are going to be at the youth level, the high school level. They're going to be minors, and that's always something that pops into my mind. And I've dealt with this in the past too, when I've worked sideline coverages. How do you deal with working with minors from a liability standpoint or consent and things like that?
So when you work with those minor teams, you're communicating with the coach or the athletic director of either the school or the program. I make sure that I have my liability form that the coaches fill out. And then I also ask the coaches to have the parents also sign those liability forms. Because when you work sideline during those games and you treat someone, you don't have the time to run across the field and then ask permission from the parents, right? So we're
Mhm.
basically asking permission ahead of time to make sure that you're covered in that aspect. And then always, when you're working with an athlete, you're asking for consent. So you're making sure that they are okay with you treating them. And afterwards, I always kind of try to relay what I did with that athlete back to the parents. So very open communication with the parents or the coach, and then having all the paperwork in line for liability as well. Usually for small things like cuts, band-aids, those are things you don't necessarily need a whole lot of like liability forms for. But like if an athlete gets a concussion or they have, a large cut on them and they have to be sent to the hospital for stitches or dislocation and things like that. Having a very open line of communication with the parents, the coaches, and then also, if you know your doctors, you can do like a direct referral to a doctor, open line communication with the doctor as well. So a lot of like open communication is key.
That's great. And when you're covering these games, practices, events, you know, uh, one thing that students have brought up to me or younger clinicians, and I'm not exactly sure how to answer it. They say, well, isn't there like Good Samaritan laws and things like that in case, somebody goes down and there's not a parent around, things like that. Where's the line with that you found to be most appropriate and most professional?
So the Good Samaritan law does cover almost anyone who wants to step in and help. Um, where it stops is if you start something, like if you were to start CPR and do compressions and then stop and then leave the scene and not come back, then you would be in trouble for abandonment. So when you start something, you have to finish it out or you have to see it out. And the Good Samaritan law will protect you in that aspect. Um, I tell my students kind of make up your mind before any emergency happens. Like right now, sit at home and make up your mind with, are you going to just call 911 and then stand there and wait? Or are you going to call 911 and start CPR? Or are you going to do breaths with your CPR or not? Know that now so that when it happens, you know your limitations and what you're willing to do. If you're kind of hesitant and you're not sure, and then you freak out and then you leave the scene, that's when you get in trouble for it. So the Good Samaritan law kind of covers all individuals. Now, if you have a medical license or some sort of background, additional education, that will just back you up a little bit more. So just making sure you don't abandon the person if you start something.
Fantastic advice. Really good advice, and people need to know that. And I think that's where taking comprehensive courses, understanding every situation, prepares somebody ahead of time, like you said, right? If you don't prepare yourself ahead of time and understand what you can and can't do, you probably shouldn't be there in the first place. But if you want to do that and enhance your career as a sports PT, you need to understand those things, and that's where you need really good, proper guidance. Um, I want to segue into how emergency medical responder training and your experience has enhanced your career as a sports PT. So can you tell us a little bit about how you feel like, being on the sidelines and working events for years and years and years now has really enhanced your career as a sports physical therapist outside of the clinic?
Yeah, so kind of going back to what I said before, when you volunteer or when you work sidelines as a PT, most of the time you're in a tent in the back doing some sort of physical therapy assessment, or I hate the word flushing, flushing athletes or doing some sort of like soft tissue or manual work. Usually the athlete comes to you or they're brought to you, and you're kind of like stuck there. And, after working many years, gaining experience and meeting the right people, I had the opportunity to now step out of the tent and also sit sidelines with the doctors, with the athletic trainers, and provide immediate emergency assistance during these events. And gaining that trust, gaining that experience with these medical directors. I mean, last year, for the first time for USA Weightlifting, they asked me to lead the team, to be the medical director of that event. And, when I started, I was in the tent in the back, right? And now I have my team. I'm leading, the massage therapist, the physical therapists, and even like the doctors sometimes, which is amazing. I never thought in my career that not only do I get to be sidelines, but also manage like a group of clinicians who, I looked up to, and I've always felt like everyone's on the same level, but I always put, doctors on a higher pedestal. I don't know if it's like growing up and my parents always instilled that in me, but at one point I was like, wait a minute, I'm going to make the doctor's schedule and I'm going to tell the doctor what to do and I'm going to have his shift or her shift. It was really surreal. So, um, really excited about that. And then getting invited back into that role. I never thought as a PT that I would get to be outside of the clinic and then also lead people at the same time. So I feel like the EMR role for me personally has taken me to places that I never thought that I could be.
That's awesome. And that's super fulfilling, right? I mean, because not everybody is able to get the fulfillment in the clinic. I'd say probably most PTs that want to do sports don't get as much of the fulfillment in the clinic that they want to, maybe because they can't see as many athletes, because a lot of outpatient clinics don't see the percentage that they would want to, right? As a passionate sports
Mhm.
PT, but being on the sideline or working events like USA Weightlifting allows you to also get that fulfillment in the passionate area that you like. And you
Yeah. And
mentioned,
it's like,
go
I
ahead.
was going to say, in the clinic, you only get to see the patient and that's it.
Yeah,
But on the field, you're watching the sport. You learn
yeah,
about the sport, you learn about the scoring, you learn about the coaches and the people. And it's such a different environment than being in the clinic and just, treating all day long. And as
hmm
fulfilling as it is to be able to take an athlete that's injured and return them to sport, I find it even more fulfilling to be able to take an athlete who's performing at their top level. They might get a little injury, be able to treat them, and then send them back in, and they do even better. So that is like amazing to me.
that's awesome. Now you mentioned a lot of opportunities are volunteer based. Are there also paid based opportunities in EMR?
Yes, so it really depends on the group or the person that's hiring you. If you're working at kind of like a high school level, they usually don't have the budget for trainers. Um, they would like to have a trainer there for their students, but they have to do a lot of fundraising. So either the parents have to contribute, or they might have like a little budget that they can use for uniforms or equipment, and they might take that and pay the trainer. So the pay for that is not going to be very high. That's kind of like your community service, giving back to your community. If you work at a professional level, again, it depends. When you work for Team USA or the Olympics, um, they have a big reputation. Everyone wants to work for them. So they don't have to pay you, and most people will end up volunteering. So depending on the sport, I would say maybe volleyball, basketball, those sports will pay to have a PT be their sidelines at the games. But for the smaller sports, I mean, they're still trying to fundraise and pay their way for their own athletes to go to events. So, let alone also pay for doctors and trainers. Usually that's at a volunteer capacity as well. So it really depends on the wealth of the company that is hiring you. I know there are pickleball teams that have a lot of money right now, and so they're hiring people to be at their events. But then, you could have your geriatric patient who loves pickleball and they're in a local team and they're not going to have the money to fund that. But you go out there out of the goodness of your heart for the experience as well and to kind of give back to the community to do that.
Very cool. Very cool. So I understand that you've also recently taken a position as an adjunct professor. So not only are you working in the clinic, being an emergency medical responder, but now you're also an adjunct professor. Can you share your journey towards what that has been like recently?
Yeah, this is the first time I'm teaching a university at a graduate level. Before I was, a clinical instructor and teaching my own EMR course to graduated professionals, but this is the first time I'm teaching inside a DPT program. And I was fortunate enough to get this position because of my students in my EMR class who happen to also be professors. And I guess they needed someone and they referred me and I got a phone call. So, pretty cool opportunity to be able to teach at West Coast University. I teach their summer elective right now on advanced orthopedics and sports therapy. And it's definitely different. It's a different setting. You're in a classroom setting and you're teaching going to be new PTs who have not gone on rotation yet. So they just have a ton of information that gets jammed into their head and no point of application yet or clinical decision making. And what I've been trying to implement in my course is to tie everything that they've learned into a more real setting, like a clinic setting. So how would I apply assessing someone's movement and then going into picking the right exercise and then programming it and then regression, progression. How do I take just using GONI skills, right? And when is that the proper time to measure and applying it to insurance and billing and things like that? And so I feel like it's a little bit more challenging. You're really like nurturing these students just because they're so new and they're so green. They're not sure what to expect. They're not sure how to answer, how to do anything. And in comparison to teaching a con ed course, everyone's working already, everyone's experienced, everyone knows what they want to do, what they want to learn. These students are still, bright eyed and unsure, not quite sure what to do. And I think that's
Yeah,
probably the most challenging thing, trying to help guide them and navigate them a little bit more.
I can imagine. And I think you and me would probably agree on this too. PT school does not prepare you enough for, even with clinical rotations, to really be confident as a physical therapist. You really just need to be immersed in uh, the physical therapy practice to get good at it. But having curriculum start to shift towards really trying to get students to think like you're trying to get them to think is, I think, so important because it doesn't seem like curriculum's changed for a very long time, and I think it needs to, especially now with the way physical therapy is. So um, that's a very cool opportunity, and I think there's a lot of physical therapists that are also interested in something like that. Do you have any, I know you just started this, but do you have any advice for them of what you've learned so far of if they want to either volunteer to work, or to get paid at the same time, um, to try to become an adjunct faculty member?
I know that they usually put listings out on like LinkedIn, but I think the best way to do anything in life, right, is to go out there and volunteer. So even in EMR, I started with volunteering, finding events that I enjoyed watching, and then just asking them if I can be there and help. As a professor, I think you could probably reach out to other professors and ask, like, hey, this is my expertise. Could I come in and help you out with a class? Or could I be like a guest speaker during a class? And I'm sure the professors would be more than happy to allow you to come in and kind of like give your 2 cents or your expertise for that lesson, and kind of get your foot wet in teaching. I find that like teaching is one thing, but actually being able to stand up there, present, and make sure that the students understand what you're comprehending um, is a bigger feat in itself. And then also like public speaking, right? So getting your reps in, getting your practice in, so that way when you get a paid position, you don't look stupid up there in front of everyone. Because I think that's like the biggest fear with public speaking, right? You're an expert, but you feel like, am I stupid right now? Like, I don't know, do I sound stupid? So getting your reps in, getting practice, getting experience. I always say volunteer first. There's no harm in volunteering, right? And reaching out to other professors to see if you can volunteer your time.
I agree with you. I think volunteering has gotten me more opportunities to this day than ever before in any field of physical therapy. The amount of volunteering I've done on weekends, because I did some sideline coverage as well. Um, Volunteering just to be at practices, be around athletes, to teach. I've done virtual teaching as well, not at the level you're doing, but uh, it 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 helps. It gets you reps, right? Get comfortable, but also
Hmm.
the more you volunteer, the more you're in front of people, you will actually get an opportunity. And I don't think a lot of people truly grasp that. You have to put your time in. You really have to be an apprentice in the field of whatever you're trying to get into to really master that field.
Yeah, I agree. I mean, I'm still volunteering, if and I
Yeah.
have any time, I'm trying to put myself out there a little bit more and do something different and, you know, all everything together. I find that I got really lucky with volunteering because, like you said, I met the right people, and now I get to be in different stages, right? Like I'm working in the clinic, kind of like when you just graduate, you get to work in the clinic, and then I get to experience being a clinical instructor. So seeing these students go on rotation and teaching them, and then now the opportunity to teach them at a stage before they even go out on rotation, and then having the opportunity to also teach after graduation and after they become a professional. So kind of being able to see, all spectrums of the stages of being a PT, and then also being able to give back to the profession, give back to the community. Um, I'm really happy to be where I am right now.
Yeah, I can tell you're very passionate about teaching, and I think that's what translates so well over into your EMR course. And I was fortunate enough to see it live when you taught here at Iowa Sports Therapy. Can you tell us a little bit about your EMR course and I guess what makes it unique?
Yeah. When I was pursuing my SCS and I didn't do the residency route, A, because I didn't know how to get into a residency, but also I just didn't have the time and I didn't have the money. I needed to pay off my loans immediately. And so I did the long route. And you have to take an EMR course in order to get in order to apply to sit for the exam for the SCS. And I took an EMR course from American Red Cross. I took it from the Heart Association. I took some from private places. And what I found and what I found missing in those courses, as good as they were, is the kind of like the athletic training aspect of it, such as taping. So there was no athletic taping involved whatsoever. And at sidelines, that's what I always get asked for. Can you tape my ankle? Can you tape my wrist? Can you tape this and that? So taping was not involved at all. And I felt like there were certain really important components that were missing also. And I think this is me being a PT coming into the sideline games. I felt like mental health was very important. I felt that being able to manage patients with certain adaptive devices or disabilities is really important as well. And then also working with, youth females who are prone to not only injuries, but things like body dysmorphia and um, nutritional aspects of it. So them not eating healthy or not eating enough. So those are all aspects that I felt was missing, and I wanted to definitely incorporate into my EMR course because that is also emergency management, right? Having um, understanding and recognizing if a youth female athlete is not eating adequately, and then her injuries are coming from that. or if an athlete is going into shock because he's in a wheelchair, he can't feel anything below his legs, but he has pain, or his urine bag is building up and backing up into his body, and he's having a systemic issue. So knowing all those small things that wasn't really taught in the other EMR courses. So I felt like I wanted to bring my vision of being not only a therapist, but also an EMR, combine the two, and then presenting it to future physical therapists so that they are just better equipped overall for these sidelines. So I added, the female athlete component to it. I added mental health, also mental health lessons on how to manage athletes that might be going through mental challenges and recognizing them as well. I added adaptive and special needs athletes to the course. Taping, which is always popular. Everyone loves to learn how to tape. So I teach how to tape, ankles, knees, wrists, using athletic tape, using kinesio tape, any type of tape. And just little tidbits and experience and stories that I learned when I was working sidelines. So I feel like that's what sets me apart from the other EMR courses.
I would say also being in your course, just the hands-on that you're very involved with it. Like you take the time for every breakout to really spend time with every single person in the course. And there was quite a bit of people here when we had our course here, where you would spend time to really break out, where people felt very comfortable actually performing the task instead of just going through the motions. And I think that's really important, because the more reps you get, the more it becomes automatic, right? Even with the taping, like you said. And that, I would agree with you, tends to be something you probably do more than anything. I mean, we have guys that roll off the basketball court almost daily during the summer right now, because they're like, oh, this happened or this happened. And, or we have a draft class that needs to be taped before they get on the field. It's so important. And now with people recertifying for SCS as well, you're required every 3 years to have 33 hours of sports venue coverage. So you have to get venue coverage somehow, and it requires you to have that EMR and to be able to use that in some capacity. So I do think that what you teach is extremely valuable in sports physical therapy right now. And I think that the comprehensiveness is what's the most valuable. So, I think your course has been really nice to have a different option than just what has been out there.
Yeah, thanks. I mean, I really enjoy being with the students and being like extra hands-on. Also, selfishly for me, I'm liable also, right? So when they go out and work, their capacity and their knowledge comes back to me. So I want to make sure that they know exactly what they're doing, that they're confident in what they're doing, because they're kind of a representation of me now, which is crazy to experience, because I never thought I would have people that I would be, somewhat responsible for. But, to get feedback from medical directors, like from jujitsu or from soccer, that tell me, I felt really comfortable working that event, or, my event had 4 therapists that went to your class and they were really prepared. They knew exactly what to do. That's the best part. And I think that's why I try to be super hands-on and as available as I can during the classes.
Yeah, no, that's great. So tell us a little bit about how people can find your courses and your community.
So my website is www.dptann.com. And on there, I list the courses that I open up for the year. Every so often, I'll add another course if I find that it's necessary for that city. But I usually list out, throughout the year, different dates, different locations. I started off in California, but I branched out to Seattle this year, and then going to also be in DC at the end of the year. My research course is also on there, so anyone can come on and register at any time, start learning right away. The course is 10 hours online. So you learn all your didactic materials, all your lessons online. And then it's one full day in class. So an 8 hour day in class, in person lab. And I formatted it that way because when I was doing the EMR classes, I hated spending a whole weekend, like 2 full days in class, especially when you work all week. And I'm like tired. I don't want to spend a 2 full days in a Con Ed class and then come Monday go back to work, right? So there has to be a better way to make it one day. And then it's just like cheaper to travel and stay for one day also. So I put all the didactic materials online and then all the hands-on stuff, all the fun stuff we do in person, and we crank it out in one day. So everything can be found on my website. And also I created a community called the EMR crew on the same website that allows all my students to interact on there. So if they have any questions, they can post something, and I can answer the question, or if anyone else can answer the question, we'll have group discussions on there. I also post opportunities. So if I hear that a soccer team needs help this season, sidelines, I'll post that on there. So if anyone wants any practice or experience, they can contact those people. So I want to create kind of like an educational community with like-minded people for all of us to be able to exchange ideas and ask questions and just kind of like grow together.
Yeah, I get it. I think it's phenomenal. I think people need that. I have one final question for you related to our EMR. What is the most unique experience you've experienced on the sidelines, like an emergency medical responder like issue? What is something that really sticks out in your mind?
Um, well, there was one event where the I was at a USA weightlifting event, and the athlete who stepped up onto the platform was going for a record lift. And he did his first lift, passed, his second lift, great. And then he really wanted to go for gold. And so he stacked on the weights. And when that happened, he ruptured his quad tendon on the platform. And it was kind of like a big ordeal. He collapsed. The entire team came on, and I thought they did an excellent job. The doctors came in, made sure it wasn't a dislocation. One doctor made sure that the pulse was managed, so there's always a pulse. One doctor went and called, 911. I kept the patient calm and stable on the platform. Doctors determined that the patient only has quad rupture, no dislocation. So let's move him off the platform so it's not scary, because everyone is like watching this happen. And so let's move him onto a wheelchair, and also it would be easier to transport him outside to where the paramedics were going to arrive. Everything went according to plan. The only problem was, you know, people talk, and the uh, the athlete and his family, called their orthopedic surgeon. The orthopedic surgeon had certain ideas on how that should have been managed, right? They wanted him to stay on the platform. They said he shouldn't have been moved. He could have bled out. He could have died. And so there was like a lot of chatter and talking and gossip, and it kind of made it so that the medical team seemed like they didn't know what they were doing, even though what they were doing was exactly how we were trained to do. And I thought the most challenging thing was to kind of stand your ground and justify that, we are all experienced. We all have the right training. We all did everything correctly, and we're standing our ground. Um, I don't really care what your surgeon said, um, but we are the one who are there, sidelines, experiencing it in real time, and then this is the decision that we make. Even the medical director stepped in and said, I would have done the same thing. I would not have done anything differently. I think that's the hardest thing, and feeling confident in yourself, knowing that what you did was correct and not second guessing it, right? There's going to be chatter. People are going to say you did something wrong, or people are going to give you input on how you should have done things. Just knowing that you did something correctly, and, just always training yourself, getting the right education, asking the right questions, reading the right books to always make sure that you're doing the right thing. I thought that was, even though everything went well, that was probably the thing that stuck out to me the most. It was scary, everyone's looking at you like you
Yeah,
did something wrong.
that is a wild experience, but those are the experiences that really teach you, right, and give you
Hmm.
what you need for future experiences. And and unless you do
Exactly.
it, unless you're there, unless you're in the trenches, you can't learn, right? And that's why you need to hear those stories from instructors and from people in the field that are doing it, so that when that happens, you're ready for it.
Yeah. It's also like a moment of self-reflection. Like, did I do everything correctly? Yes, I did it correctly. The next time, would I've changed it a little bit so that nobody can say otherwise? Probably, probably could have better crowd control, better communication with the coaches, the athletes, and maybe even hop on the phone and talk to that surgeon, and nip that
Hmm.
in the bud instead of having rumors be spread too. So definitely a moment of self-reflection as a team.
Yeah, awesome. And really appreciate you sharing your insights and your experience with us today. It's clear your work as an EMR and a sports physical therapist, along with your role as an adjunct professor, brings incredible experience and value to the field. So your journey is very inspiring to, I'd say, current and even aspiring sports physical therapists. And I just really appreciate your time.
Thank you. Thank you for having me.